communication is a 7 years age old girl. She is Sarah. Sarah has HIV. Okay. Now
Hmm.
you are a nurse. You want to tell Sarah this information, but the parents don't want that Sarah know the information. Now you want to ask me. I am an SGC doctor.
Okay, so I am the nurse and you are the doctor. So I want to disclose to Sarah or to you?
Disclose to Sarah that Sarah has
Okay.
HIV, but her parents not want. Uh, that is.
Okay. 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 So shall we start? Sorry, I
Wait,
have
I
one
have to speak.
confusion. Uh, Sorry, I have one
Mm.
confusion. I'm the nurse and you are the doctor, huh?
Yes, you are the nurse.
Yeah,
I am the doctor, and Sarah is patient who is a 7 years age old girl. She is HIV
hmm,
positive. You want to
hmm.
disclose this to Sarah, but parents not want to disclose that. Now you want to
Yeah.
discuss it like this.
Yeah.
Okay, you can
Okay.
start.
Yeah. Okay. Hello. Good morning. I am Mrs. Mrs. Noor, and I'm a nurse here. I'm working in this hospital. I believe that you are a Dr. Rabia.
Yeah, yeah, I know you. Dr. Lama. Today morning we meet together, and I heard that you are a very hardworking nurse.
Yeah, thank you so much. You know that I have some concern, and I'm really upset in the morning round. And that's why I come to you to discuss something about this Sarah's condition. Is it a good
Yeah, yeah,
time
I
that?
heard that you have some concern about that. So, okay,
So,
so before you
so
want you want anyone to join this meeting?
no, it's no, because I think this is something confidential that I need to discuss first to you. So
Okay.
it is the right time to talk to you.
Yes, you can ask me what you want to know.
Yeah. I have one concern that, Sarah, she is 7 years old and unfortunately, her HIV result came positive. And she's so small, and her parents are also know this thing. But in morning round, I come to know that her parents are not willing to disclose this to Sarah. So
Yeah,
this
yeah.
is really bothering me. Why I'm really This is frustrating for me. Why they are not disclosing this thing to Sarah?
Okay, okay. So I'm explaining it very easy way. What happened, uh, in this matter, actually, it is really very much confusing matter. There is no any black and white, and there is no any, true or false anything, right or wrong. So
Hmm.
we have some rules to decide what to do and what not to do. And do you have any idea about these rules?
Yes, I have some idea, but I think some decision we need to take, and there is some autonomy like that. But I have some confusion. So what we will do now for her?
Yeah, yeah, excellent you are. Autonomy is that, that is the child right, the patient right, that he has the right to take the decision of his fate. But, we are doctor of children, so we have to think about the parents' right, also the children right. So both right we are
Hmm.
thinking, and that is one autonomy. That is our first thinking. And,
Hmm.
the second thinking come on benefit versus risk. What do you think about that, this benefit and versus risk in this matter?
I heard that this is the second rule of this one, and the benefit will be if the Sarah come to know that she is HIV positive, so she is more like a cooperative to take the medicine, and she will not ask why she is taking the medicine. And
Yeah,
secondly, the
yeah.
more important thing that we will not have to lie on her. I
Okay, I
think
understand.
and
And
this will be the
do you
benefit.
think any risk about telling this information, disclosing Sarah this information?
Yeah, yeah, I feel that because this is the social. Some people consider it as a social stigma, and it will affect her mental activity, mental status, and she will psychologically affected. Maybe she will go
Hmm.
into depression. This is the main
Yeah,
factor.
this is the main effect, that is. So here, if we
Mm.
think that benefit versus risk, what happened? The risk is she can be even suicide on go depressions. Her life,
Yeah,
this type risk occur. That's why that is another point we are thinking. and um,
yeah,
and the third point is that you know the best of child interest. Here, that is also we are thinking. That is idea. What is the best of this child?
Yeah, the best interest, if we will, because now she is very young, is just only 7 years old. The best interest that if we will not tell her, so she will maybe cope up this thing easily. She will not get into depression. I think this will be the best interest, I guess.
Yeah, yeah. For that reason, actually, we are thinking about that. Okay. So, do you have any other concern you want to know about this Sarah matter?
Yeah, I have. So at this stage, so what we will do? If the mother is still insisting that she will not tell, she don't want to tell the Sarah, then what we will do?
Actually, for all three rules, we are thinking the autonomy, the benefit versus
Mm,
risk, and the child best interest. Everything we think, we are thinking that we are not currently not telling Sarah disclosing this matter HIV. It will be on later we think, and later we can say. But now we are thinking not to disclosing. Is that clear?
okay. Yeah, it's that clear. I have one more concern that now
Mm,
Sarah is 7 years old. Soon she will become sexually active. So what will happen? How she will come to know?
yeah, yeah. That is also, you are totally right. Actually, this is our third rule, which is justice. It means that her a
Hmm.
sexual partner to know. But we should make
Hmm.
sure that she knows and follows the protective measures before become sexually active. And for that, actually, now we are not disclosing, but maybe we later can be disclosed. Now, actually, we are not going this matter. So, 6 minutes. Okay. Do you understand?
Oh.
Are you agreeing with this point with me?
Y- Yeah, I'm absolutely agreeing and following to you. So
Okay, okay.
most of the things you have cleared to me, and I'm really
Hmm.
appreciated for this.
Yeah, yeah, and you also a very quick learner, I think. So,
Yeah, thank you.
so what you think? What we discussed? Can you please summarize that for me?
Yeah, absolutely. Sarah, who is admitting in our hospital, she's 7 years old and she is non-competent. You have told that she is HIV positive, but in her best interest at present, the parents are not willing to tell her about her HIV status. And you have told me the reasons why you are also agree on this, the autonomy and the justice and risk versus benefit, and all are told to you, and you have also told to me the future plan, when she will come to know, when she will become sexually active, and she will know the HIV status when she become sexually active.
Yeah,
So
we'll be gradually we'll think that this matter later, but currently we are not disclosing, and we will
yeah, yeah,
ensure that she will use the protective measure. So I think
yeah,
you're a
yeah.
very nice and keen learner. You're really very active. I admire you,
Thank you so
and
much.
thank you very much for that. And also, I'm giving you some trusted websites, some leaflets, and some important information about this matter. So if you have any, you can learn much more. So it's okay.
Mm, mm. Yeah, okay, thank you so much. I will definitely go through this.
Yeah, thank you for coming here. If you have any point, any question, you can ask me anytime. I'm here to
Yeah,
help you. Okay?
okay, okay, thank you so much.
You're most welcome. I think 20, 30 seconds remain. Okay.
What
So, mm,
what else question can be asked? I think here we can ask the competency level also. That
yeah,
the nurse can ask, is she competent enough
yeah, yeah,
that she can make her she can take her decision or not? Then you
yeah,
can
yeah.
explain that she is not
Okay.
GLIC competent at this time. Then
Okay,
she
yes.
can ask her, yeah, and
Actually, what
also,
in Fraser competency is about advice and treatment relating to
hmm,
contraception and sexual health.
yeah, yeah,
But
hmm,
this is issue
uh,
is following here Gillick competency. Did you
yeah,
have
yeah, GLIC.
heard about this before?
Yeah, I heard that GLIC competency is something who check the ability of the child to make decision.
Yeah,
Yeah.
the child has the maturity to make their own decisions and understand the
Hmm.
implication of the disease. According to the criteria, she is not
Hmm.
competent. So that's why we are not telling her.
Hmm.
Okay. So
And the
thank you. I think you
other,
are a very true, you are a very speedy learner. Thank you.
yeah.
So I think over
And
and
one
time
more,
also over. Hmm.
Yeah.
Okay.
And one more
Hmm.
question we can ask, like, if the mother is continuing insisting, that we can ask that we will arrange a meeting with our consultant and the
Yeah.
mother, and then yeah, and then we will discuss all the same points, and
Yeah.
gradually we will
We will
counsel
have a
them to.
meeting with the men and our consultant, and we'll discuss with the men the issue we have
Hmm,
said, and we can suggest to
hmm,
tell the girl on a gradual way,
hmm,
step by step, about her
hmm.
diagnosis. So you have
Yeah,
not
yeah.
asked me now. You need to continue asking me, then I will give the answers. At the end, you are
Yeah,
asking me this. But
yeah,
one
yeah,
thing I want to tell you, must you have studied that very nicely. You know, every
yeah. Okay.
point you can memorize that. Thank you very much
Yeah.
for your participation.
Thank you so
Okay. So next, what we practice?